this is how we scan the kidneys. As we know, the kidneys are situated on the sides of the spine, and so we should know which organ we are scanning, and that is how we have to place our probe, and we have to focus on that organ. And this is how the kidneys looks on ultrasound. This is an example of a gallbladder calculus. As I told you that this calculus or the bone, they are a strong reflector of ultrasound. So these structures look bright on ultrasound. This is the gallbladder, and this is, here is a calculus, and distal to the calculus we can see there is a black shadowing because the ultrasound beam is reflected, and the ultrasound beam is not crossing distal to this calculus, so we could not see structures distal to this calculus. So this is called shadowing. And the same way as in abdomen, we can use to ultrasound to scan the thyroid. Here is a patient. We are using the probe to scan the thyroid, and this is an ultrasound image. We can nicely see thyroid, right lobe, isthmus, left lobe, and these are the carotid vessels. These are the neck muscles, and this is the subcutaneous tissue. And this is a pregnant patient, and this is a specimen of a fetus, and this is how an ultrasound image which shows that there is a fetus, and this is the sac, amniotic sac, this is the amniotic fluid, these are the umbilical cord. So this is how, by knowing the anatomy and by knowing the different organs, orientation of the organs, we can scan these organs. Another applications are like, as we can do the ultrasound in the abdomen and other areas, we can also use these ultrasound to image inside the, like from the vagina. We can go close to the uterus and the ovaries, especially in obese patients where from the abdominal wall we could not image these organs. By using a transvaginal ultrasound, we can see these organs very clearly in a much more high resolution. Like this is a case of uterus, this is the endometrial cavity, this is a case of uterus with a amniotic sac and a fetus inside. So we can obtain a very high resolution images of female genital tract by using a transvaginal ultrasound. In the same way, prostate can be approached from the transrectal route, and a very good high resolution images of the prostate can be obtained by using a transrectal probe.